Doctor, talk about what you're trying to do here at your practice. You have a big expansion coming up, a new facility. What's the philosophy behind what you are trying to do here?
Yeah, well, Regenerative Medical started about 4 years ago, and at that point, I was doing mostly orthopedics and sports medicine, and we're also at that point we're doing some of what's called prolotherapy, which is a type of regenerative medicine. And at that point, I decided to kind of start my own clinic because I wanted to do things a little bit differently. And that was kind of somewhat maybe two reasons I did that. One was I think my patients were demanding it. They didn't want the cortisone shots, they didn't want Band-Aids, they didn't want pain medications, and I didn't want to practice where I was always refilling pain medications and giving people cortisone shots and Band-Aid approach. So we started Regenerative Medical really to do two things. One, to expand our regenerative medicine side of what we do. And number two is to expand what we call the functional medicine side of medicine, which is more looking at optimizing people's function on the inside. So a good example, we say a patient comes to see me, they've got a degenerated knee, and we work it up, we get the MRI, there's arthritis, they've lost their meniscus, and they've got tons of arthritis in this knee. So they want me to do some regenerative procedures like prolo or stem cell to try to regenerate the cartilage. So that was no problem, we could get the body healing, but we're finding that if those patients weren't optimizing their health, if they weren't eating right, if they weren't eating healthy foods, if they weren't optimizing their supplements, if they weren't at an ideal body weight, that knee would only get so much a response to those injections that we're doing to try to stimulate the repair. So we kind of expanded from the orthopedics and non-surgical sports medicine to the functional medicine, optimizing people's hormones, checking to see what supplements people are deficient on, making sure people are eating well, and then getting their ideal body weight.